Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on the investigations that we have to do for diabetes mellitus. Basically, we have to understand two things. One is we are measuring the plasma glucose in 100 ml of blood. In 100 ml of blood, how much is the glucose present in milligrams that we are testing? And one more thing we are testing is HbA1c. This is basically glycosylated hemoglobin. We have our blood, right, in our body. Blood contains red blood corpuscles, that is RBC. When excess of sugar is present in plasma, this RBC combines with the sugar and forms glycosylated hemoglobin. This gives an indication of there is a rise in the blood glucose for the last 2 to 3 months. So these will get glycosylated. Measuring the percentage of this glycosylated hemoglobin, we can check what is the condition of the sugar levels in blood for the last 2 to 3 months. So this is the background. One more thing the patient has to remember is, see, normally most of the patient what they do is for going checking blood plasma levels or sugar blood plasma levels or glycosylated hemoglobin, what they do is they don't take the diabetes medicine on the previous day. It is a wrong thing to do. What you have to do is, so if you are going to get checked up or if you are going to measure your blood plasma glucose levels, you should be on regular diet, you should be on regular medication, whatever you are taking for diabetes, and then take the test. Basically we have to test in your normal scenario, in normal, in day to day regular activities, how you are performing on the same controls we have to have for test. We will now understand how to estimate the glucose levels and what are the things we need to consider, what are the normal levels, what are the abnormal levels. Basically we can divide patients into three groups. Any person we can divide into three groups based on the plasma levels of his glucose. So we can consider him as a non-diabetic patient, pre-diabetic patient, and diabetic patient. So basically non-diabetic patient is a absolutely normal individual from the perspective of blood glucose levels. Pre-diabetic person is a person where there is no full-blown disease or full-blown diabetes, but he is prone to get diabetes in near future. So we will check the levels. Basically we will divide into four groups. Preprandial means before eating food or fasting blood glucose, we will measure fasting blood glucose. And also postprandial or OGTT, oral glucose tolerance test, or post lunch glucose also we will measure, and we will classify the patient whether he is non-diabetic, pre-diabetic, or diabetic. And also random blood sugar, how much random blood sugar also we will check. On top of it we will also check HbA1c, glycosylated hemoglobin, we will check. We will check preprandial or fasting blood sugars. If the blood sugar is 70 to 99 mg per dl, we call him as non-diabetic. And if the fasting blood sugar is 100 to 125 mg per dl, we call him as pre-diabetic. And if it is greater than 126 mg per dl, we consider him as diabetic. This is for fasting blood sugar. For fasting blood sugar, the patient should fast at least for 8 to 12 hours. Within 8 to 12 hours he can take only water, other than water he should not be taking anything. Next one is postprandial blood sugar, or we call it as oral glucose tolerance test, or also post lunch glucose. So what should happen in this is, you are fasting for 8 to 12 hours, you will eat something. What you will eat normally is 75 milligrams of sugar or glucose you have to take in 200 ml of water, or full meal. You can take a full meal, carbohydrate meal, and get the uh, sugar levels checked after 2 hours. If he is a non-diabetic person, his glucose level should be between 120 to 139 mg per dl. If it is a pre-diabetic patient, his glucose levels will be between 140 to 199 mg per dl. If he is a diabetic, his glucose levels will be about 200 mg per dl. In the same way, let's check the random blood sugars. If the random blood sugar of a person is between 70 to 129, he is considered as non-diabetic. If the glucose is greater than 200 mg per dl, he considered as diabetic patient. So, and what about the HbA1c? So for HbA1c, if the glycosylated hemoglobin percentage is 4.0 to 5.6, we consider as non-diabetic. For a pre-diabetic patient, the glycosylated hemoglobin should be between 5.7 to 6.4, and for a diabetic patient it should be greater than 6.5% of glycosylated hemoglobin. Apart from plasma glucose levels and HbA1c, there are other tests that the diabetic patient has to undergo. These tests he has to undergo at least in every 6 months. What are these? First one is liver function test. You have to check the function of the liver, because diabetes affects the liver drastically when it is uncontrolled. And also kidney function test. Kidneys can be damaged due to diabetic nephropathy, so we have to at least check the kidney function for every 6 months. And also lipid profile, you know that increased glucose levels in the body will increase the HDL level, and also this may lead to heart attacks. That's the reason we have to check lipid profile every 6 months. And serum electrolytes, electrolyte balance is very important within the body. If there is imbalance, the patient may land into problem. That's the reason you have to check serum electrolytes every 6 months. There is no organ which will not be affected by diabetes. In that, thyroid is a major one. The major cause for thyroid disorders is diabetes, so we have to get T3, T4 and TSH checked every 6 months. There are some tests for diabetes which they have to do at least once in a year. First one among them is fundoscopy, because due to diabetic retinopathy, the retina may get damaged. That's the reason you have to get examination for your retina every year. The next one is urine microalbumin. So you have to check for the washout of albumin from your body. This may be because of damage to the kidney. Next one is ECG and also treadmill. You have to do yearly at least once, because elevated blood glucose levels may cause heart attacks due to deposition of cholesterol in the coronary arteries. For that, you have to get tested for treadmill test and ECG. Next one is ultrasound abdomen. Ultrasound abdomen is very important. There are many diseases that can be detected through ultrasound. It may be kidney stones or fatty liver or any other thing. So ultrasound is very important. It has to be done at least once in a year.